say for example, Doc, we want to undergo cataract surgery, pero kunwari kinakabahan kami, matatakotin kami, pero we also want to have clear vision. At yung cataract namin, mature na, there's no other way for us to achieve clear vision but to surgically remove it. How would we do it?
Ideally, this cataract surgery is done under local anesthesia, but we can also do it under IV sedation. So that especially for patients who are anxious or who are
like
old
me.
enough, there's also option for IV sedation naman. So ibig sabihin, pinapatulog namin yung patient para comfortable naman siya.
So, ano yung oldest patient, Doc, na pwedeng mag-cataract surgery? Pag 80 years old na ako or 85 years old na ako, pwede pa ba akong mag-cataract surgery?
Yes. So, regardless of age, the patient can undergo surgery. I personally have a patient who is 88-year-old. Kaya naman, no? As long as the patient is coherent, can understand instructions. But even if the patient is, let's say, medyo mahina yung pandinig or is not cooperative, we can still do the operation under IV sedation, and as long as the patient is also cleared by an internal medicine doctor that the patient is eligible, we can do the surgery.
So ano yung mga kailangan nating medical clearances before we can advise a patient to safely undergo cataract surgery?
So before cataract surgery, we require patients to undergo series of tests, laboratories like blood workup, ECG, chest X-ray, and the other stuff. And then we send this laboratory to a doctor or cardiologist or internal medicine just to give them cardiopulmonary clearance. And depending on the results of the laboratory, if there are any deranged results, that's the time we refer to different subspecialties. So
For management muna.
Yes.
So, cataract surgery is very safe and it can be done even in a very elderly patients. So, actually, local anesthesia lang ang kailangan and it's only 15 to 30 minutes. That's how quick it is. Pero syempre, for some patients who are anxious, like me, medyo anxious ako, feeling ko hindi ko kaya ng local anesthesia, yung aware ako. So, buti na lang, meron ding option ng IV sedation.
Yes.
And don't worry, because cataract surgery won't be performed if you also do not have a medical clearance that will instruct us na you are safe to undergo this kind of procedure. And so, Doc, ang next question ko, so syempre, di ba, yung cataract surgery, tatanggalin natin yung natural lens ng mata mo kasi cloudy na siya. So, you said kanina, kailangan palitan ng artificial lens or intraocular lens. Now, anong klase ng intraocular lens yung pwedeng pagpilian ng mga tao na pwedeng ilagay sa mata nila?
Okay. So we have different types of intraocular lens or IOLs. So first we have the monofocal, and then we also have the multifocal, extended depth of focus lenses or what we call the EDOF, and the toric IOLs. So first, the monofocal, this is the most common type of IOLs used in cataract surgeries. No?
This is the cheapest also.
This is the cheapest, yes. So this monofocal has only one distance focus. So most people set it on distance vision. So it means to say that only the distance vision is clear. They will still need to use eyeglasses for reading or near work.
Okay.
Next, we have the multifocal. So the multifocal provides both the distance and near focus at the same time because this type of IOL has different zones set at different powers. So with this type of IOLs, people don't usually need to use eyeglasses for near work because it can already provide far and near this vision. And then next, we have the newer type, the extended depth of focus or the EDOF. This is similar to multifocal, which can also give clear vision for near and far, but with only a single corrective zone. So this zone extends for both the distance and near. Now, sometimes we refer this EDOF as more of distance vision and intermediate.
Okay.
And then finally, the toric IOL. So for patients with very high astigmatism, we give this toric IOLs.
As much as possible, I really recommend patients to really invest in their surgical procedures and their intraocular lens. Why? Hindi kasi ho ito parang eyeglasses na for now, this is just my budget, so ito muna yung eyeglasses ko, pero next time, after a few months or by next year, pag kailangan kong magpalit, pwede akong mag-upgrade. This one is a surgical procedure, and as much as possible, we only want to do this once. So, you invest on it the first time.